Now let's talk a little bit about hyperglycemia. So a nurse calls you about Mr. Brimley in room 1203. His blood sugar is 345 on a point of care test to assess his blood sugar. The real question is, why do you care? You might be saying to yourself, well, am I worried about it getting worse? Am I worried that the nurse is going to keep calling me? Am I worried that I really don't know what I'm going to do? So before we go in and immediately address this issue, what do you want to know about this patient? Take a second and think, if I was going to ask this patient questions or ask the nurse questions, what might I want to know? So here are some things that I wrote down and you may have thought of yourself. When did the patient last eat? When was the last time they received insulin? Is there something that's maybe affecting their blood sugar? Something that we're doing, giving them corticosteroids? Is there dextrose in their IV fluids? Are they on new tube feeds or TPN? Or is the patient simply snacking? You go in to assess the patient and you find out that the patient just had a very large Slurpee. So now the question is, the patient has an elevated blood sugar. We know that they have a Slurpee on board. The question is, what do you want to do? So the first thing you probably want to do is to make the patient NPO so that their blood sugar does not continue to rise until you have better management. You also probably want to send a BMP to rule out diabetic ketoacidosis that we'll talk more about shortly. And finally, you probably want to begin to correct their hyperglycemia with some rapid-acting IV insulin, which is usually 5 to 10% of the weight-based total daily dose. I'll show you a table in the next slide that will help calculate an amount of insulin to give. So, depending on what the blood sugar value is, we can look at how much insulin is recommended. So in our patient, his blood sugar right now is about 350, so we should probably be giving somewhere between 3 to 5 units of IV insulin. As you can see, as the blood sugar increases, the amount of IV insulin that we would give will increase. Now that you've given your patient insulin, please keep in mind that you want to avoid insulin stacking, meaning avoiding multiple insulin doses stacked on top of each other without leeway in between. We also want to be cautious in patients who have kidney disease, have a change in their diabetic status, are brittle, are elderly, or have beta blocker usage. The reason we're concerned about kidney disease is because insulin is metabolized in the kidney, so someone with an AKI or acute kidney injury might have difficulty or variability in how they process the insulin. Additionally, patients with beta blockers might have blunted adrenergic response and therefore might not show the typical signs of hypoglycemia. They might not show the shivering, the discomfort, the high blood pressure, or rapid heart rate because a beta blocker is preventing these symptoms. And finally, we need to remember that IV insulin peaks in about 1 to 2 hours. So we definitely want to recheck this person's blood sugar after 1 hour.